Good morning. Let's talk about when should you freeze your eggs if you decide to freeze your eggs. The best age is around age 32. Should you freeze it any sooner? Maybe for some people. If you have a history of endometriosis, you've been having severe pain, you can go ahead and have your anti-Mullerian hormone level tested or have an antral follicle count done. What is the anti-Mullerian hormone? It is a hormone produced by the small follicles that are still left inside your ovary. So it's like a roundabout way of trying to assess what we call your reserve. So if you find that you're in that category and you have a very low reserve, you might want to consider freezing your eggs sooner rather than later. Another category of women is women who've been diagnosed with cancer, may consider freezing their eggs before they go through chemotherapy. In fact, they should consider. And I always encourage my oncologist colleagues to always include that conversation when the diagnosis of cancer is initially made, because that's the last thing on people's minds. So you got to keep that in mind. Now, can you freeze your eggs any later? You can. You can freeze it up to age 37, 38, 39. But bear in mind, as you get older, you may need to freeze more and more of the eggs, if you want children in the future. Especially if you want more than one child, you might want to consider freezing more. Ideally, we want you to freeze 15 to 20 mature eggs. If you're older, close to 40, that number may escalate up to 30 or 40. The problem is you may not have that many eggs at that age. So definitely consider freezing your eggs sooner rather than later. Most of the time, you really don't really want to freeze your eggs age 42, 43, because it's very hard to get good eggs at that time. So you want to freeze your eggs around age 32 or so. You want to freeze it if you have any illnesses that may impair your quality. Those are the things to consider.